CapExpert is a true end-to-end supply chain solution that is fostering the development, the improvement, and ultimately the better care delivery in the outpatient space. There hasn't been a more disruptive healthcare vertical over the last 20, 30 years than outpatient healthcare delivery, and it truly is the bedrock of value-based care. CapExpert enables outpatient facilities to deliver better care by having better asset management so that leadership can understand what equipment is where, what condition it's in, the ability to decommission, have better capital plan, and ultimately get better equipment in the hands of the providers so that to the benefit of the patients that are becoming consumers of healthcare more and more by the day, so that when a patient is lucky enough to qualify or finds a surgeon who specializes in outpatient healthcare delivery, whether it's a surgery center or an imaging center, they're there and the providers are able to use the best, newest, well-conditioned equipment on every patient that they see so that the continued adoption of outpatient care with the ultimate goal of lowering the cost to the patient population continues to be the disruptive force that it has been.
Hey everybody, it's David Kemp, host of Highway to Health podcast series, and I appreciate you being here. If you've tuned in, you already know what we like to discuss. We like to celebrate the people, the solutions that are improving this healthcare journey of ours, this open road journey to improved access, improved experience, improved outcomes for our patient community. But we know it'll take a village and it'll take a little bit from everybody to get where we want to go on this road to improved healthcare. Today, we're going to look at how an improved asset strategy not only helps the patient experience and those outcomes, but also how it can save our providers money and it can help everybody involved by streamlining this care journey that our patients and providers are on. And that's why I'm really excited to have the CEO and co-founder of CapExpert on Highway to Health today. His name's Luke Johnson. Luke, welcome to Highway to Health.
Excited to be here.
Man, I'm glad you're here too. We're going to get into a lot of things today, but the tradition on Highway to Health is to ask our executives, our professionals, about their own healthcare journey and some of the habits that you've built into your daily routine to stay physically and mentally sharp. Share with us something that you've implemented into your daily routine to maintain that strength and readiness.
Yeah, absolutely, David. I was fortunate enough. I played college sports. I played football at the University of Dayton. So I kind of escaped the college years in better shape than I entered, unlike a lot of people. So definitely started with a good foundation, but ever since then, staying in that routine and that accountability really comes down to my routine and identifying what my fitness goals are. So instead of trying to bench press 225 as much as I can, I'd love to play a round of golf now without a sore back, right? So actually, I'm really starting to get into some PT. It's kind of my new thing I'm doing right now that recently is just, hey, let's take care of this body. I've only got one of them. I beat it up for years and years through high school and college. Playing quarterback, I've got some crunchy shoulders. I played catcher all through high school, so I've got some weak knees that I'm working on. So for me, it's kind of about sustainability at this point and something that's repeatable. And getting in the gym, staying active. Recently moving to Denver, so getting out on the hikes and taking credit for all those exercises. That's what's keeping me going right now.
So the freshman 15 for you was like a freshman 15 of muscle. For us who weren't D1 athletes, it wasn't. Those 15 pounds weren't good pounds.
Yeah, the freshman 15 definitely came in the form of bigger legs and chest for sure. Those 6 a.m. workouts were no joke.
I want to ask you a little later. We'll get into maybe how the quarterback position is such a cool position. I'm fortunate enough to know you and a few others that played that at a high level. And just from an outsider's perspective, it seems to be one of those things that may have provided some experience that has led you to success professionally.
Yeah, absolutely. Sports in and of itself it's the greatest competition, right? And once you're removed from the standardized organizations, college football, baseball, whatever, at any level, you kind of look around and you see just where you can apply the lessons that you learned on the field. I made a joke earlier with you that sports is the only place where if you don't do the little things right, you ultimately could get physically hurt. If I don't check the protection properly, I'm going to get hit, sacked, blindsided, and it's a real quick reminder of, hey, maybe you should have watched a little more tape to understand what the blitz looks like. So taking some of those lessons, developing that grit, and just understanding the difference, of or the benefit of the pain of same versus the pain of change, and really owning my company's future, my own personal professional future, and knowing that if I can apply myself, put the work in properly, I saw that I could lead to a bigger, higher number when I'm bench pressing or completing more passes, or today it's generating more revenue as a company, delivering more savings for our clients, and ultimately trying to improve in healthcare.
Well, I mean, being a catcher, being a quarterback, leadership's in your blood. Both of those positions, you're responsible for everybody on the field, and you're touching the ball every play. And so it's cool to see how that translates to business. And I think we see those parallels all the time. So I appreciate you sharing a little bit about that with us. Give our listeners a little perspective, especially from the provider side. When we talk about Cap Expert, you're the CEO founder. You must have seen something or experienced something in the market that gave you this idea and maybe opened your eyes to the challenges and opportunities that were there. Give us that perspective from your firsthand experience, and then maybe a perspective from the provider side.
Yeah, absolutely. So Cap Expert is the tried and true story of founders that built a solution to a problem that they experienced every single day. My team, we operated a group of surgery centers for one of the largest surgery center group in the country. We also sold into healthcare facilities as reps for some of the biggest med surge supply companies and implant companies. So, living it firsthand put us in a very unique perspective versus most startups. And the problem that we were solving, first and foremost, was visibility. So, Cap Expert, our job is to help outpatient facilities right now manage, maintain, and procure medical equipment faster, smarter, and more efficiently. And as healthcare continues to move from inpatient to outpatient, like we saw in our jobs before we went full time with Cap Expert, we saw the opportunity to the patient population. It was there hasn't been a more disruptive is probably the word I want to use there. A more disruptive vertical in healthcare than outpatient healthcare delivery. The core of value-based care is getting the right patient to the right site of care. So we saw the benefit it was already generating through years in the space, but then we also saw, from our perspective, just how much more value could be squeezed out of the system if we could just help these facilities and vendors and service providers collaborate and coordinate much more efficiently than they are today. All of those results lead to better savings, smarter decisions, and ultimately allowing our providers to get out of the minutia of finding all the best options, pulling every value lever that they can, whether it's better pricing, faster lead times on delivery, selling their used equipment for better prices, and helping them ultimately get back to their patients, which is what they're there for. And one of the burdens of staff that are at the outpatient facilities is the way that they're able to operate efficiently is that they typically have 2, 3, 4 job functions versus your traditional administrative stack of people that you could see inside of like an inpatient facility.
So you touched on something that whether it was value-based care or the patient experience, dig in a little bit there on how Cap Expert and the solutions that you're providing to the provider how that can impact in a positive way this disruption that the patients have experienced in terms of access to care, and even how that lack of access negatively affects their experience during the care journey.
Yeah, so the core benefit of surgery centers or anything that's outpatient really is just how simplified the balance sheet is. And so you can directly tie revenue to expenses and see the profitability of certain procedures and ultimately the facility at the end of the day. So, in a very easy to understand business model, what you tend to see is these facilities holding on to existing pieces of equipment for beyond manufactured useful life, just because they don't necessarily want to go out and make the expenditure for all new OR tables or all new OR lights, or uh, making an investment in their orthopedic equipment because it's working well. The outcomes are very clear and easy to track, but ultimately for the patient, what they experience is going to a lower cost site of care, and the facility is utilizing older equipment. Now, there's no reason a patient who is becoming more and more of a consumer, making the right decision to go to an outpatient facility for less cost, but at at typically higher outcomes, better outcomes, lower infection rates. The facility doesn't need to be using older equipment because it's just the way it has been and it's always worked. So what our goal is to help these outpatient facilities have a better capital plan, because right now anything that goes wrong is always very reactive, and when they need to go buy something new, it's typically because either the manufacturers has stopped supporting it from a service perspective or a repair piece perspective, or it literally breaks down and they've got to scramble and go get a piece of equipment so that they can continue to operate. So um, ultimately, again, our plan is to, or Cap Expert drives transparency to all of those opportunities and risks for buying new equipment, replacing old equipment, selling something that's underutilized, or redeploying within a network, so that the ultimate beneficiary is the patient, who can receive an even better standard of care.
Yeah, and even the wait times, right? I mean, if a facility needs a piece of equipment and they can't, you know, provide the services or render the care that their patients need without this piece of equipment, if they were to buy it new or buy it through a different channel right now, those lead times are drastically increased. Cap Expert helps shorten that lead time so that patients can get access to that care sooner, which benefits them, their experience, and their outcomes, but it also benefits that provider because now they can recognize the revenue, right? Am I understanding that correlation correctly?
That's exactly right. Nothing more frustrating for a patient or a provider if they have to cancel a lineup of cases because a piece of equipment has become faulty or broken or recalled. So, to your point, exactly, staying out in front of any risk to the standard flow of scheduling and having a patient, know exactly what to expect, show up on the day of their case, and knowing that nothing's going to happen and they're going to be ready to go, because scheduling and everything else, recovery times, PT, all of that starts at the surgery. So you could delay everything downstream. And ultimately, what we do is we help these facilities not only plan to replace that equipment, but we give them as many options as we can. So we sheepishly, because it's used in healthcare so frequently, we deliver what we call value-based purchasing. So whatever the facility values the most, they're typically willing to pay for. This is removing that back and forth negotiation, cat and mouse of your inbox between the rep and the materials manager or the facility administrator, and kind of cuts through the noise and allows for the facility to say, look, we need this here as soon as possible. We will pay for the expedited shipping. We will consider as many options as we can, because we want to be able to have the smallest disruption to our surgeries as possible.
You know, Luke, my mind immediately goes to consumerism and how humans are impatient beings anyway. And if this facility doesn't have the equipment that they need to render the care that I'm expecting, in this rise in consumerism in healthcare, is the provider at risk of that patient going and finding somebody else to render that care? And they not only do they lose that revenue, but maybe the patients at greater risk?
No, David, it's a great question and a great point. So typically, and it's great that you bring this up actually, because this is actually the founding origin story of Cap Expert. The instance that we had is we actually had a surgery center when I worked for one of the major management groups that had two orthopedic surgeons that wanted to operate on the same day, but they only had one C-arm, so your intraoperative imaging system. And when it comes to consumerism, it's actually it's a double-edged sword. You've got the patient who's going to want which specialist can see me the quickest. They're going to bounce around. They might take a referral from their PCP. But you've also got the surgeon side. So you've got the surgeons that operate in their markets. They're core parts of their community, and they want to have a great reputation, deliver great care, which ultimately brings more word of mouth referrals, which are the number one source of new business, especially in specialties like spine orthopedics. So you've got the patient wanting to be seen the fastest and operated on in the best facility, but you've also got the surgeon who is responsible for that surgery for that patient, wanting to deliver the care as quickly as possible at the best location. So in this instance, if a piece of equipment is down, the facility, if it's a standalone surgery center, they're actually at risk of losing the opportunity to deliver that care if the equipment is not up to snuff, it's not running properly. And the origin story of Cap Expert was those two orthopedic surgeons wanting to operate on the same day. And ultimately, the younger surgeon took his lineup every single week to the hospital instead of the surgery center, which was more expensive to the patient. It's ultimately, new data is showing it's riskier from an infection perspective, and the lead times are just as long. And it all came down to one critical piece of equipment, the facility not wanting to make the investment. But really, if once we got into the facility, we realized just how much was being missed from an opportunity perspective for revenue. So what we ended up doing was sending out an email blast to every facility within this network of ASCs, asking simply, is somebody not using a C-arm? And there was a facility in Florida that was liquidating. So you had these two red flag events. You had a facility on the West Coast that was losing tens of thousands of dollars a week of surgery revenue. And you had another facility that was trying to get the most for their liquidation of this equipment. And we connected those two dots, and it ultimately saved about 15 weeks of delivery time versus buying something brand new from an OEM. Those were the lead times then. And almost over $100,000 versus buying something brand new and doing a peer-to-peer transfer. And that was the light bulb moment went off. Cap Expert kind of started as what if we built an internal Craigslist for these outpatient facilities to work better together, and realized just how many players were in this ecosystem that could benefit from the kinds of insights from the asset management to the procurement. We call it co-pilot, the procurement automation for all these facilities.
I've had a lot of these conversations on Highway to Health, whether it's, digital health, care coordination, financial management. It doesn't really matter who I'm talking to in healthcare. One of the common themes that is driving a lot of the challenges that we're trying to solve in healthcare comes down to collaboration and connection and communication and breaking down barriers so that patients and providers can talk to each other. Providers and providers can talk to each other. They can share data. And, almost on accident, I use this term, it's going to take a village. Well, the village has to talk to each other. They have to be connected. In our conversation today, what I'm hearing from you is even in asset management, that siloed communication, that siloed data is preventing a lot of these providers from delivering the kind of care that they're passionate about on the timeline that's important to them and to the patient. It's all about these siloed information systems needing to be broken down so that we can coordinate and collaborate more effectively.
Yeah, absolutely. And the other big gap is just confidence in the results. So you've got facilities that need to go buy this equipment. They want to make sure, and this, very few solutions out there right now, they want to make sure they're getting the best price, the best option. Everybody wants a deal, right? They don't always want the lowest cost piece of equipment. If lowest cost is all that matters, we'd all be driving 20-year-old cars, right? And so the facilities want to know and benchmark, did I get all the best options I could? Did I get the best price? And are my needs being met? And am I getting a good deal? And am I willing to pay for it? And that's really what we're unlocking. And on the vendor side and the service side, whether it's logistics or service contracts for the facilities or even financing, they all want to know that they're delivering exactly what the customer wants, the client wants. And these facilities are, they're juggling multiple RFPs right now in their inbox when they go to buy a new piece of equipment. And if we could cut out the cloudiness, if we could clear the fog of the sales negotiation back and forth, then we are ultimately making a more united healthcare platform, continuum of care, because now everybody is really looking at what's most important. That's delivering the best care to the patient.
And there's things that are required, and all you're doing is making those pieces of equipment more available on a shorter timeline at the right price. The Craigslist of healthcare equipment sums it up really well.
Yeah, it's really about allowing vendors to find the customers that need their solutions. It's about increasing visibility. Again, it's the number one benefit of decentralization is lower cost to the patients, but the number one negative portion is they lose visibility and leverage to everything that they own, all their negotiation power, all of their options. And then you've got everybody else in the ecosystem that surrounds an equipment purchase, and they're sitting there saying, well, who can we help? Where are they going? Where are we needed? And without a home base, if you will, of where all these transactions are happening, all you're going to have really is the kind of the common what's gotten us here to today, where it's, well, I've always used Jimmy to help us with our equipment or to whatever else. And really, no offense to Jimmy, there could be better options out there. And really, that's all we're trying to deliver is a new home base or conduit for the entire medical equipment ecosystem.
I think transparency is so important. It drives accountability across the entire spectrum. And now what you're really impacting is the affordability of care.
That's the goal.
Your personal experience and the provider's perspective and feedback have played a huge part in the development of CapExpert and what it is today. Tell us what's next. What's on the horizon? If you were to look down the road 5 years from now, what do you see next in terms of iteration or offerings or opportunity for CapExpert?
Yeah, so our core offerings right now are capital asset management platform. So we call it CAMP. And that's a full digital twin process of every single facility so that leaders can, for the first time, understand what equipment's where, what condition is it in, how old is it, anecdotal conditions. So like if Dr. Johnson likes to, play Frisbee with some of the equipment when he gets frustrated, you get that kind of data. And by laying that foundation, using some proprietary AI that we've built so that we can build each piece of equipment can get a full facility profile down to the specs just based off of partial information. So my dev team has been doing a tremendous job. Once you have that foundational data, you see just how much downstream it can affect. So whether that's the decommissioning of the equipment, we have a platform that we call Copilot, as I mentioned before. So when a facility needs to replace one of those older pieces of equipment, they can file one RFP through our platform, and that RFP will end up in dozens of vendors' inboxes or on the platform as well. And they can remove, again, the back and forth out of the inbox into a single pane of glass, let the facility compare multiple vendor options, let the vendors win very warm inbound leads, because the biggest difference between ASCs and hospitals is where all the hospitals are because there's a blue sign with YH on every exit of the highway, so you know where it is. Surgery centers are being put into different places, lower costs. I used to cover a surgery center that was in Water Tower Place in downtown Chicago on the 10th floor. So, but if you ever been to the American Girl doll mall. 15 floors above you, they're doing total joint replacement and spine surgery. You never would have known. So yeah, it's a really exciting time right now where we sit. The ability for us now is to bring in better partners in that ecosystem we talked about. So service contracts, such a critical part to extend the life of existing equipment. So you want to talk about lowering the cost of care. The bread and butter, the lowest hanging fruit is let's just make sure the equipment the facilities already have stay up and running and in great condition. So helping drive that. And then additionally looking at how do we help facilities creatively own, manage, use, rent equipment that they need to continue to deliver the care, bridge the gap to the point where they can acquire the equipment themselves, or again, working with vendors closer and closer so that we can really close that gap between the facilities and the OEMs or the distributors. And the better job that we can do on closing that gap is the part of healthcare that's expensive. The cost, the SG&A in medical device and equipment sales is 250% higher than other industries like software and industrials. So that's truly, when we talk about visibility for that 100th time, understanding where the opportunities are, what the customer's needs are, and then all the options that the customers can pick from. That's CapExpert's true north.
I had a conversation on Highway to Health a couple weeks ago with the CEO of Austro Health, and he talked about the friction throughout the healthcare ecosystem. And, the friction here is obvious. And what you're trying to do is smooth that process out, streamline it out so that people get what they need when they need it at the cost that they need it so they can do the job that they're being paid to do. And it all makes perfect sense because we've all been there. No matter what side of the coin you're on, the patient side, the provider side, the vendor side, we've all felt this pain at some point through our healthcare journey or our professional career if you're in healthcare. And so, it's one of those things where it's like, why didn't I think of that? So congratulations to you guys at CapExpert for providing such a great service. If you could leave our listeners with, one thing, or maybe, if they could walk away from this conversation remembering one thing, what would that piece of advice be?
So I'll go back just to something simpler about being, a leader in general with whether it's your own organization, whether it's your own team, whether it's your household, whether it's whatever. And what I've learned throughout the process of CapExpert over the last few years, you talked about how it takes a village. I've always said it takes a huddle. Right? When I played quarterback, I could have been Lamar Jackson, but if I didn't have an offensive line, I wasn't going to be very effective. So surrounding yourself with people that you trust, that are ultimately more talented than you are, that they are putting the work in, ultimately you can be you can get the results a lot like me, where you're not the most talented person in the huddle, but because you've surrounded yourself with incredibly smart, talented people and you're constantly in pursuit of not being the smartest person in the room, then the outcomes become more than you could have imagined because you're putting your trust in your team. And ultimately that raises the outcomes of whatever mission you're on. It makes it a whole lot easier if you're all pulling in the same direction and everybody's got the same vision.
Yeah, well said. I'm a big sports guy and I couldn't agree more. It takes a little bit from everybody. And when you're surrounded by like-minded people pushing or pulling in the same direction, you can accomplish great things. And that's what we're seeing in healthcare across the spectrum. And CapExpert is definitely a part of that village, or to use your words, a part of that huddle. Thank you for coming and sharing a little bit about what you're seeing in the healthcare industry, the opportunities that are there to improve access, experience, and outcomes, and connecting the huddle, the village, to a solution that can make a profound impact. Luke, thanks for joining Highway to Health.
Thank you, David.